Sometimes Kathy Cranston of Austin visits one of her friends with a special purpose in mind. He uses a wheelchair and relies on a community attendant for getting in and out of bed, toileting, dressing, meals, and more. The attendant has young children and misses days. During the pandemic, this is common. Cranston says most community attendants are mothers or grandmothers, and COVID's effects on childcare have them scrambling. Cranston is head of the advocacy group, Personal Attendant Coalition of Texas, and also a grandmother and professional community attendant for 30 years. But this is one call she makes for free, because she wants her friend to keep his home. But the reality is, she said, not everybody has that informal support. So then what happens is they go without. Another man in the Round Rock area has no informal support, which is the industry euphemism for unpaid family and friends who fill in the gaps in state services. He's had numerous surgeries for the slow-healing, excruciating pressure sores that strike people in wheelchairs, often because of insufficient help that leaves people stranded in their chairs. But he fights to stay out of institutions as a matter of life and death. Sometimes he can't find attendance, Cranston says, so he makes a decision to stay in bed and just gets up when he can. Otherwise, he's in bed, she says. It's not a good quality of life, and it only makes it worse for him. That already existed before COVID-19, and this pandemic's only exacerbated it. 178,000 Texans like him rely on home and community-based services, or HCBS, to live at home and in their communities. But even before COVID-19, the system in Texas was in trouble. Community attendants are paid through Medicaid at a base wage set by the legislature at $8.10 an hour, far below other jobs. 2/3 of the jobs turn over every year. Now the pandemic makes those relying on HCBS face the prospect of institutionalization at the deadliest time. Vox reports nursing home deaths in Texas rose 64% in the past 2 weeks. KTRK TV says COVID-19 deaths take a devastating toll on nursing homes. The Houston Chronicle says Texas finally got COVID data on nursing homes, and Houston is faring the worst. Attendants also lack paid sick leave. Dennis Burrell of the Austin-based advocacy group, Coalition of Texans with Disabilities, says this presents the risk of bringing the virus into the home of a person who is at high risk, which is a foolish plan to say the least. A failure of the community care system would put our highest risk population into the riskiest locations. That's a pretty frightening scenario. He says, the chicken place a block from my office starts pay at $15 an hour. There's a sign at the pizza joint around the corner that says, our drivers make up to $20 an hour. We have gotten into a society that values a pizza or a chicken sandwich more than it values the dignity and health of our fellow human beings. They're spending massive amounts of money on federal supports to bail out certain industries. So we're going to bail out the cruise ship industry before we're going to bail out our direct care workers who go into the homes of people at the highest risk of severe illness. I understand there's low-paid workers at hotels and cruise ships, and they need to be taken care of as well. But if you're really interested in the workers, why don't you include the workers currently at the front line of this pandemic? When asked about social distancing and her line of close contact work, Cranston laughs at the notion. Fear by attendants and recipients over bringing the virus into homes has injected a new level of uncertainty into providing services. For COVID-19, attendants require a full complement of personal protective equipment, or PPE, including gowns, masks, and gloves. She said the situation has improved from the beginning of the pandemic, but there's still need. In El Paso, for instance, the agencies are still rationing, including 2 masks a week for each attendant. Some agencies in Austin are still having a hard time. She said in an email that she's still mailing out masks to attendants in Travis County and surrounding areas. Cranston said they rely on nonprofits to make up some of the shortfalls. People on Medicaid can't afford PPE, she said. It falls on the state to supply monies. We are essential. People rely on us to drink, go to the bathroom, or to get out of bed. But the reality is our state leaders have a responsibility to the people that receive services, and they have a responsibility to have these things put in place. In Washington, two stimulus packages totaling $3 trillion included increases for Medicaid and hundreds of billions of dollars for state and local governments, any of which could fund home and community-based services. Advocate Alison Barkoff of the Center for Public Representation urges activists to put pressure on the states. She says, I think state advocacy is so important. On the HCBS side, there's so much flexibility that states have. There are these big chunks of money that gone to states, whether it's the 6.2% Medicaid bump or the big pot of money that went to states for recovery or even education funds. It's going to be really important for the disability community to advocate at the state level so some of those funds flow into disability systems, whether it's about special education or HCBS systems. I mean, you can see those monies going completely to other priorities at the state level. In March, the Democratic House of Representatives passed a $3 trillion follow-up, the HEROES Act, directing $875 billion to state and local governments, a 14% boost in Medicaid and a 10% boost in HCBS. In response, the Republican Senate released the $1 trillion HEALS Act just yesterday. It has none of these things. Cranston joins Barkoff calling for boosting HCBS pay and sick leave using the billions flowing to states through federal stimulus and increased Medicaid funding. She calls on Governor Greg Abbott and the legislature to use budget execution authority to reapportion funds to solve this long-standing problem, or to tap into the $8.5 billion rainy day fund maintained by the state. A message to Governor Abbott's office went unreturned. She and Burrell also urged state Medicaid expansion, which will ensure Texans at 90% federal expense, and would bring back tax dollars that Texas pays out to subsidize Medicaid in other states. Part of the Affordable Care Act, Medicaid expansion remains available to 14 states. We have to address this issue. It's not going away, Cranston says. They must do it now because what we're saying is people with disabilities' lives are not worth it, as well as the workers that provide those services. We're saying, let them die. It's okay. For the People's News, this is John Mohler reporting.